Now, let's see what happens during tamponade. This is basically a clinical, not an echocardiographic diagnosis. Echocardiography will show signs of increased intrapericardial pressure, but the patient may not be in tamponade. For instance, one of the first signs indicating that the intrapericardial pressure is high is when we see a diastolic and early systolic collapse of the right atrial wall, since this cavity has the thinner wall and lowest pressure of the heart. This sign obviously indicates that intrapericardial pressure is higher than intra-atrial pressure. In the past, this sign was thought to be diagnostic of cardiac tamponade. It sure is not. Commonly seen in patients with no clinical signs of tamponade, but if found in patients with clinical suspicion of tamponade, it's sure a very helpful sign. Here is an example in a patient with clinical tamponade. Look at the collapsing of the atrial wall, indicating high intrapericardial pressure. One echocardiographic sign that is probably really an indicator of cardiac tamponade is diastolic collapse of the right ventricular wall. So far, we have seen it only in patients with the clinical signs of tamponade. Since the right ventricle wall is thicker and the cavity pressure is higher than in the right atrium, the intrapericardial pressure must be much higher to produce a collapse than in the right atrium. Here, an example. Watch how the right ventricular cavity collapses during diastole. One more example. Notice the collapsing right ventricular cavity during diastole. Another example. Huge pericardial effusion. See the collapse of the right ventricular cavity. One interesting case, rupture of the right ventricular wall by a catheter with hemopericardium.